When I talk of blood clots, most people have a mental image that it would be someone elderly, bedridden, or very sick in a hospital. But in my OPD or clinic, the most dangerous clots I see are in people who walked in feeling 90% normal. Their first sentence is always, "Doctor, I'm healthy. I never thought this could happen to me." Deep vein thrombosis or DVT is like a silent sniper. It always doesn't announce itself with screaming pain until it becomes life-threatening. Today, I am answering the top 10 questions that people ask after the fear sets in. We are going to clear up the confusion between simple muscle pain and a medical emergency. So let's start with the big one. How do you tell the difference? So when we say it's a muscle cramp, it's usually sharp, it grabs you, and usually once you massage it or lightly stretch it, it feels better. It's loud, but a blood clot is much deeper. It's not a scream, it's a constant dull roar. It feels like a deep ache or tightness that won't go away with stretching. In fact, if you pull your toes up and feel a sharp pain in the calf, that can be a warning sign for deep vein thrombosis, which we call as Homan's sign. The second question that our patients ask is, why is my left leg swollen but the right leg is absolutely fine? And I tell them, trust the asymmetry. Your body is designed to be symmetrical. So if you have any systemic cause, maybe the heart, kidney or liver, both the legs will swell. But if only one leg looks like a balloon and the other looks absolutely normal, then it can be a very definite sign of deep vein thrombosis. So if you see a difference in size, don't wait. Third common question is that I have no pain, just heaviness. So am I safe? No. This can be a big trap. A clot is like a blockage in the flow of the vein. And once the clot reaches a certain size, only then will it give rise to pressure symptoms. So even if your pain just feels heavy, tight, dragging with a little amount of swelling, but there's no sharp pain, don't wait for the pain. These symptoms itself can be significant to ensure that you go to a doctor directly. Now coming to some myths, and this question number 4 is very essential. I walk daily, I'm an athlete, can I get a clot? Yes, because being fit lowers your risk, but it doesn't make you invincible. Serena Williams, if you know the tennis player, one of the greatest athletes in history, she also suffered from pulmonary embolism. So you can have great muscles and endurance, but sticky blood. Factors like dehydration, hormones, or even genetics, they don't care how fast you can run. The question 5 I often hear from people is that I only flew for 4 hours. Isn't that enough? And we call this as the economy class syndrome. It applies to chairs and offices also. It's not just about the time. It's about the kink in the pipe. So when you sit cramped, your vein is bent and the blood starts spooling. So if you are dehydrated, then the blood can ultimately form a clot. So that changes your blood from water into something like a ketchup. So even if you are flying for more than 4 hours or you have taken a 4 to 6 hour journey in a car or a train, these conditions can be perfect for formation of a clot. Now question number 6 is very true in today's era. Can stress cause clots? This is a fascinating one because stress doesn't put a clot into your leg directly, but stress does increase our cortisol hormones, which in turn increase the inflammation and blood pressure. Plus, when we are stressed, what do? We sit at our desk for hours together. We often forget to drink water, or maybe worse is we switch to alcohol, which can dehydrate your body. So stress creates the environment where clots can thrive. Now coming to the questions which relate to dangers. And question number 7 is about massage. Please listen to this one because someone told you that massage a pain and it will be fine. But if you suspect a clot, a massage is the most dangerous thing you can do. Because when you massage your leg, the clot from that leg can straight away travel to the lungs, giving rise to a life-threatening emergency called as pulmonary embolism. So never ever deeply massage a swollen, painful calf until you have consulted a doctor. Question 8 again is a common question. When we see them in the OPD, explain them the dangers, they always ask, is it an emergency? Well, think of any clot as an emergency. Even if the symptoms are less, you never know which clot can break off and lead to life-threatening emergency. And there's no way of knowing who can have an emergency and who cannot. So we treat every patient with blood clot as an urgent or emergent basis because you cannot gamble with the lungs. Now the last two questions relate to prevention and recovery. Question number 9, is dehydration a myth? So think of pouring water versus pouring honey. When you are dehydrated, your blood volume drops and the blood gets much thick or viscous. Your heart has to work harder to push it, and thick blood will always move slowly, and slow blood can lead to clots. So please drink your water. Dehydration is one major factor for developing blood clots. And question 10, which many of you have asked us, will I be normal again? Yes, most of the patients treated in time and who follow rest of the advice can go back to their normal routine. But it's important that the treatment has to be made perfect. The treatment has to be continued for the duration your doctor advises you. And apart from medicines, taking care of your lifestyle, wearing stockings, exercising, ensuring good water intake, and taking care of your weight, all these aspects are very important if you want to live a normal life again after developing a blood clot. But before you go, there is one question that people often forget to ask. What happens to the vein after a blood clot? Well, even after the blood clot is gone or dissolved, the damage might remain. So what happens is that the valves within the veins are often damaged, and because of damage to the valves, there develops something called as a post-thrombotic syndrome, which happens years after a blood clot. And this can lead to swelling and even end up with a massively swollen, painful leg with skin changes and ulcers. And that is the reason why compression stockings after your clot is treated is very important. Compression stockings are the most effective way to support the veins and the valves so that they can still do their job. So if you have noticed one leg looking different from the other, or a deep ache that won't go away, don't Google it. Go to a vascular surgeon, get a Doppler scan done. It's a painless, quick sonography kind of test which gives you the only answer that matters. If you found this video useful, do share it with someone who travels often. I'll see you in the next video.